Hi. The topic we are going to discuss in the subsequent classes is JE motility disorders in intensive care unit. We'll start with the overview and it is going to be a MCQ bar case-based discussion. So we are going to discuss what is the importance of GI motility, what kind of nutrition we are going to prefer, whether it is enteral nutrition or parenteral nutrition, the physiology of GI motility, what are the various motility neurological components which is associated with it. Then we are going to see structure wise. We are going to start with esophageal motility, its physiology and pathology, that is the gastroesophageal reflux diseases, followed by stomach, the gastric motility, which is the physiology, followed by the pathology, which is gastroparesis. Coming to the small bowel motility, the migrating motor complexes and interdigestive motor complexes, which forms a physiology, and its pathology following that, which is the ileus. Then how we are going to counteract this gastroparesis in ileus, either through post-pyloric feeding or the usage of prokinetics. Then what if the motility is prolonged? Here we will be discussing the diarrhea in ICU, followed by constipation in ICU, and finally acute colonic pseudo-obstruction or Auxiliary syndrome. It is an MCQ based discussion. We'll start with an MCQ. Our patient is a 78-year-old male admitted in an ICU following a road traffic accident with left lower limb mangled extremity and moderate traumatic brain injury. He undergoes a debridement and a below knee amputation for the mangled right lower limb extremity. The traumatic brain injury was conservatively managed. He is on ICP control measures, which includes your analgesia sedation, which is your opioids and benzodiazepines. As an ICU consultant, you are planning to initiate this patient on nutritional therapy. Identify the correct statements. A. Early initiation of enteral nutrition is recommended. B. Presence of bowel sounds are mandatory for initiation of enteral feeds. C. Enteral nutrition may increase the incidence of pneumonia. And finally, whether enteral nutrition should be stopped at the first sign of feed intolerance. The first thing we are going to see is the advantages of having a enteral nutrition in critical care. What are the advantages of enteral nutrition? It is simpler and cheaper, and it is widely available. Irrespective of what kind of resourceful settings you are working in, it is going to be widely available. And third one, whatever the components, whatever the complications is going to be associated with total parenteral nutrition, be it line related complications like presence of CLABSI, pneumothorax, bleeding, hematoma. If you are going to give a peripheral parenteral nutrition, which is PPN, you may have to give it as high volume. All these things, whatever the complications are associated with the parenteral nutrition, you can circumvent those by giving a enteral nutrition. And in ventilated patients, enteral nutritions are known to decrease the incidence of stress ulceration. And what are the subsequent advantages? One, the presence of feeds in the stomach, it increases the gut blood flow. When there is a preservation of gut blood flow, obviously your gut mucosa is going to get preserved, so protection of gastric mucosa. What else? When there is an intact gastric mucosa, your gut immune function is going to be preserved. So third point is improved gut immune function. Then it decreases the catabolic response to the injury. And finally, when there is a decreased catabolic response and improved nutritional delivery, obviously you are going to have a improved wound healing. So these are the various advantages associated with the use of enteral nutrition in critical care. Is it evidence based? So it is a systematic review and meta-analysis of 6 RCTs. Close to 234 participants were analyzed. The early enteral nutrition is associated with significant reduction in mortality and pneumonia. So although there is a detection of statistically significant reduction in mortality, considering the overall trial quality, the trial sizes being small, so we need subsequent larger studies to reciprocate the same effects on mortality. So that is the only thing. So now we have discussed what are the advantages associated with the enteral nutrition on top of parenteral nutrition. Second, whether the enteral nutrition is evidence-based, the advantages of enteral nutrition or evidence-based.